Schizophrenia is a psychological condition that causes a change in thought pattern and social behavior. Schizophrenia is thought to be a genetic disease that can be triggered by traumatic events in a person's life and affects approximately 1% of people in the United States. Some symptoms include trouble with social interactions, distinguishing what's real and what's not, and improper emotional responses.
Recent advancements in science have changed our views with respect to the causality of paranoid schizophrenia. The old view attributes it to social and prenatal stresses. Children are much more sensitive to stress than adults, and this can precipitate psychosis. The new view involves epigenetics, changes in gene expression not resultant from altering the DNA sequence. This can change during our lifetimes, perhaps due to aforementioned stress or drug abuse. Since most cases of schizophrenia are diagnosed later in life, it would make sense if gene expression could be altered via epigenetics. Part of this is DNA methylation. This is part of the normal development of higher-level organisms. It is the addition of a methyl group to the 5 position of the cytosine pyrimidine ring or the number 6 nitrogen of the adenine purine ring. Basically, DNA methylation, once the human organism is developed, could lead to variation in gene transcription and ultimately schizophrenia.
I have no function for communication and investment. Coffee futures at 23% investment. I have to have Claudia Schiffer effect style corporate coffee futures in professional design. Future concept to have professional living and function. Money to be independent and wealth generation for entertainment. I have no function for communication and investment. Coffee futures at 23%.
Occasionally, it can begin in children at the age of 5, but it's usually not diagnosed until later in life. For men, diagnosis is common in their teens and early 20s, and in women, it ranges from 20s to 30s.
Bastard. Hello. Why are you ignoring me? You're bad. Hello. You're disgusting. You're filthy. You're bad.
There are 3 different categories of schizophrenia. Paranoid, which we will be concentrating on, where people think that others are against them and tend to be aggressive. Catatonic schizophrenics have issues relating to movement, and they have trouble controlling their muscles and facial expressions. Disorganized schizophrenics tend to act childish and have trouble conveying their thoughts and feelings appropriately. There is no cure or prevention for the disease, but it can be treated and controlled with antipsychotic medications.
Medical treatment of schizophrenia. Olanzapine and risperidone both act on the nervous system by affecting dopamine neurotransmitters. Risperidone is in the benzoxazole group, and olanzapine is in the thienobenzodiazepine group. Both of these lessen the amount of dopamine, which has been shown to prove effective in treatment but not prevention. These are both known as atypical treatments, which have been released post-1990. Some typical treatments, which have been around since the 1950s, are chlorpromazine and haloperidol. Chlorpromazine is a dopamine antagonist and an antiserotonergic agent. It is marketed in the U.S. as Thorazine. Haloperidol is also a dopamine antagonist. All of the mentioned drugs are known commonly as antipsychotics.
While the disease is not fatal, many people with the disease who do not seek treatment become suicidal.
Jump now. Jump in front of the car. Go on. Do it. No, don't.
Corporate coffee futures and professional design. Future concept. Corporate coffee futures and professional design. Future concept to have professional living and function.